Hello everyone, this is Charita from Sri Venkateshwara College of Engineering, Computer Science Department. In this video, I am going to talk about human heart from the subject Biology for Engineers. Now let's get into the topic human heart. The heart is a muscular organ in the most animals. This organ pumps blood through the blood vessels of a circulatory system. The pumped blood carries oxygen and nutrients to the body, while carrying metabolic waste such as carbon dioxide to the lungs. In humans, the heart is approximately the size of the closed fist and is located between the lungs in the middle compartment of the chest called mediastinum. In humans, other mammals, and birds, the heart is divided into four chambers, that is, upper left and right atria, and lower left and right ventricles. Commonly, the right atrium and ventricles are referred together as the right heart and their left counterparts as the left heart. Fish, in contrast, have two chambers, an atrium and a ventricle, while most reptiles have three chambers. In a healthy heart, blood flows one way through the heart due to the heart valves, which prevent backflow. The heart is enclosed in a protective sac, the pericardium, which also contains a small amount of fluid. The wall of the heart is made up of three layers: epicardium, myocardium, and endocardium. Next, physiology of heart. Heart functions as a pump in the circulatory system to provide a continuous flow of the blood throughout the body. This circulation consisting of a systematic circulation to and from the body and the pulmonary circulation to and from the lungs. Blood in the pulmonary circulation exchanges carbon dioxide for oxygen in the lungs through the process of respiration. The systematic circulation then transports oxygen to the body and returns carbon dioxide and relatively deoxygenated blood to the heart for the transfer to the lungs. The right heart collects deoxygenated blood from the two large veins, the superior and inferior vena cava, that collects in the right and left atrium continuously. The superior vena cava drains blood from the above the diaphragm and empties into the upper back from the right atrium. Next is heart rate. The normal resting heart rate is called as sinus rhythm, created and sustained by the sinusoidal node, a group of pace-making cells found in the wall of the right atrium. Cells in the sinusoidal node do this by creating an action potential. The cardiac action potential is created by the movement of the specific electrolytes in and into and out of the pacemaker cells. The action potential then spreads to nearby cells. The adult resting heart rate ranges from 60 to 100 bpm. Here bpm means beats per minute. The resting heart rate of the newborn can be 129 beats per minute, and this gradually decreases until maturity. An athlete heart rate can be lower than 60 bpm. During exercise, the rate can be 150 bpm with maximum rates reaching from 200 to 220 bpm. Next is clinical significance. Disease. Coronary artery disease, also known as ischemic heart disease, is caused by arteriosclerosis, a buildup of fatty materials along the inner walls of the arteries. These fatty deposits, known as atherosclerotic plaque, narrow the coronary artery, and if severe may reduce blood flow to the heart. If a narrowing is relatively minor, then the patient may not experience any symptoms. Severe narrowing may cause chest pain or breathlessness during exercise or even at rest. A thin covering of the arteriosclerotic plaque can rupture, exposing the fatty center to the circulatory blood. In this case, a clot of thrombus can form, blocking the artery and restricting blood flow to an area of the heart muscles, causes a myocardial infarction or unstable angina. In the worst case, this may cause cardiac arrest, a sudden and utter loss of the output from the heart. Obesity, high blood pressure, and controlled diabetes, smoking, and high cholesterol can all increases the risk of the developing arteriosclerosis and coronary artery disease. Next is heart failure. Heart failure is defined as a condition in which the heart is unable to pump enough blood to meet the demands of the body. Patients with a heart failure may experience breathlessness, especially when laying flat, as well as ankle swelling, known as a peripheral edema. Heart failure is the result of the many diseases affecting the heart, but is most commonly associated with ischemic heart disease, valvular heart disease, or high blood pressure. Less than less common causes includes various cardiomyopathies. Heart failure is frequently associated with a weakness of the heart muscles in the ventricles, but can also be seen in patients with a heart muscles that is strong but stiff. The condition may affect the left ventricle, the right ventricle, or both the ventricles. Patients with heart failure high, are at higher risk of developing the dangerous heart rhythm disturbances. Next, the treatment for the heart failure is the underlying cause for the patient's heart failure, most commonly ischemic heart disease or hypertension. The mainstay of the heart failure treatment is with medication. This includes drugs to prevent fluid from accumulating in the lungs by increasing the amount of urine a patient produces, and the drugs that attempt to preserve the pumping function of the heart. In some patients with a heart failure, a specialized pacemaker known as cardiac recyclization therapy can be used to improve the heart pumping efficiency. These devices are frequently combined with a defibrillator. In very severe cases of heart failure. A small pump called ventricular assist device may be implanted with supplements of the heart own pumping ability. In the most severe cases, a cardiac transplant may be considered. Next, here is some of the interesting facts about the heart. A human heart beats about 1,15,000 times each day and pumps about 2,000 gallons of the blood every day. The average size of an adult heart is the size of our two hands claps together, and a child heart is about the size of the fist. On average, our heart beats 70 to 72 times per minute, and it and 2.5 billion times in a complete lifetime. Women heart pumps faster than a man's. A women are more prone to cardiac diseases. Heart heart cancer is a rare compared to other cancer because the heart cells stop dividing at an early age. The heartbeat with which we all can hear is caused by the opening and closing of the heart valves. And this is the end of the video. Thank you for watching. Please do like, share, and subscribe to my YouTube channel. We'll meet in the next video. Thank you all.